What emerging tools detect lung changes early in CF? Imagine catching lung issues before they become serious. That's the goal of new tools in cystic fibrosis care. Researchers are developing ways to spot early lung changes so treatment can start sooner and keep lungs healthier longer. One of these tools is the Lung Clearance Index. It measures how well air moves through the lungs, especially in small airways. Unlike traditional tests that mainly look at larger airways, the Lung Clearance Index can detect tiny changes before symptoms show up. This makes it very useful for monitoring disease progression, even in children who seem fine with standard tests. But it does need special equipment and trained staff, so not every clinic has it yet. Another promising tool is magnetic resonance imaging, or MRI. MRI scans give detailed pictures of the lungs without using radiation. They can show early signs like airway wall thickening, mucus buildup, or bronchiectasis, which is when the airways become abnormally widened. MRI is especially helpful for young children and infants because it's safe for repeated scans. Over time, MRI can track how the disease develops from infancy through childhood, helping doctors see how well treatments are working and when to adjust care. Computed tomography scans, or CORT scans, are also very detailed. They can find early structural changes in the lungs, like mucus plugging or bronchiectasis. But because CORT involves radiation, doctors prefer to use it carefully, especially in young children. That's why MRI is gaining popularity as a radiation-free alternative. Researchers are also exploring biomarkers, specific substances in the body that indicate lung inflammation or damage. For example, certain metabolites found in fluid from the lungs or in breath samples can signal early lung changes. These biomarkers might help predict future problems like bronchiectasis more accurately than traditional tests. Scientists are working on less invasive ways to measure these markers, such as analyzing breath samples, which could make monitoring easier and more comfortable. Finally, new home monitoring tools are emerging. These combine portable spirometry devices with symptom questionnaires that patients can do at home. This allows for ongoing tracking of lung function and symptoms, helping to catch worsening lung health early. Especially for patients waiting for lung transplants or with advanced disease, these tools can provide valuable real-time information for timely medical decisions. In summary, the most exciting advances for early detection in cystic fibrosis include the Lung Clearance Index for sensitive lung function testing, MRI for detailed, radiation-free imaging, biomarkers from lung fluid and breath for early signs of inflammation, and home monitoring systems that combine spirometry with symptom tracking. These tools work alongside traditional tests to give a clearer picture of lung health and help doctors intervene sooner. Always remember to talk with your healthcare team about the best approach for your individual care, as each person's experience with cystic fibrosis can be different.